How many have seen the movie Moneyball or read the book? The first time I read the book, I was like, oh my God, this is exactly process improvement and what healthcare needs, is to look at things differently. There's a great scene in the movie where they're sitting on the scouts. They're all, aged scouts. They've seen it all, right? And they're talking about the potential players they're going to draft. And they went in about this one guy who had the skill set, but I swear to God, in the movie, the guy sitting off to the left says, his girlfriend's on a scale of 1 to 10's a 4 or a 6. And Billy Beane in the movie looks at him, what are you talking about? And he says, well, that means he has no self-confidence because his girlfriend on a scale of 1 to 10 is a 4 to 6. And I thought, that's what we do sometimes. We don't judge girlfriends, but we use rumors and innuendos to make some decisions, right? And so we're using this old model of healthcare from the 50s sometimes, and we need to kind of step back. I was in a meeting the other day, actually the meeting that I was supposed to be at this morning that just popped up on the screen, and we were talking, and there was a concept that we wanted to introduce to this hospital, and they were struggling with it, and I was trying to get them to think outside the box. And it popped into my head. I said, you know what we needed to do is a field trip. And so I said, you need to see outside the box before you start thinking outside the box. And Dan and I were talking earlier in the conference, and he said, you were just out at Denver, right? And Denver Health has done a great job for about 5-6 years, maybe even a little bit longer, of introducing this concept. But when you go and see it in real life getting done, and there are some practices out there, frontline practices, that have really changed the flow of their patient, flow of information, the design of their workflow, their floor plan, to improve how they impact the patient experience. So some of the things that I took away from that video is you need to get creative, you need to look at new knowledge, you need to question everything, anything and everything, obviously in the right way, because if you just continue hammering them, you're going to be annoying, and then they'll leave you alone. They won't listen to you. Look beyond the traditional metrics. And then it's what is overvalued and undervalued in your organization. Think about that.